Oh, okay.
Uday, you're on mute.
Sorry about that. I didn't realize. 1 second. Let me just go back. Can you still see my slides? Yeah.
Yeah.
Okay. So thanks everyone for joining us today. So this is the second webinar organized by DAYLife. And the topic today is patient peer support. We got a fully packed agenda today. So we got a series of sessions from different experts who have been doing a lot of work on patient peer support over the last few years. And before we actually start the session, I would like to introduce briefly the K-Quip team, which who have kindly coordinated this for us, mainly Georgie and Kay, who I think have sent the comms around this webinar to you all. So we got Rosie, who's a co-lead with me on DAYLife, who's leading on the Advanced Kidney Care Clinic project. And we got other program managers who are part of the K-Quip team, Julie, Leanne, Ranjit, and Catherine. So general housekeeping rules. We may not have necessarily time for questions. So what I would like you to do is if you do have any comments, please put it in the chat box. And if you put in at my name and then put in your comments, then I will pick up these questions as the session proceeds. If we do have time, we might be able to pick 1 or 2 questions for discussion at the end. The meeting is going to be recorded, and the recordings will be available later on for people to review if needed. So there may be some photographs taken. What we have also planned through the webinar is to get your thoughts and views on some of the priorities for us as a working group nationally. So we would like to use the Mentimeter survey. So if people can put their thoughts and comments and feedback for those questions on the Mentimeter survey, that would be very much appreciated. If you have your phone next to you, please dial in www.menti.com and it will ask for a code. And if you could put that code in, it will allow you to access the questions. There are some questions which we will ask you to complete at the beginning of the session, maybe in about 20 minutes time. And there are a few questions that you can complete through the webinar so that we can look at some of the feedback and responses at the end of the webinar in the last session. So I will put up a QR code in a minute so people can use the cameras on your phone to scan the QR code to access the Mentimeter survey. So right at the end of the webinar, we will be asking for you for a pledge. Again, that's done through the Mentimeter. And again, there will be a survey feedback on the webinar. Kay will put that in the chat box now and again towards the end of the session. So if you could provide us some feedback on how the webinar was and any areas for us to improve for the next time, that would be very much appreciated again. So this is the QR code for the Mentimeter survey. So I'll give you a few seconds for people to scan this code using their phones. That should directly take you to the Mentimeter survey. Good. So what are we going to cover today? So I will set the scene with giving an overview of what we have done around DAYLife, which is dialysis at yours life fulfilled, to promote home therapy nationally, and where peer support fits in within the DAYLife program. We're going to look at what the journey has been so far around setting up peer support nationally and the challenges individual teams have faced. We're also going to look at what resources currently available, what is available in terms of peer supported training and different models that people have adopted or used over the years to provide peer support to patients. And towards the end, we will be looking at some recommendations from some of the work we have done so far and we would really value your thoughts and help with prioritizing those recommendations so that we can take forward those as a national working group. So this will be done as part of the Mentimeter exercise. And hopefully we will identify people interested in working with us to set up a national peer support working group. So as per the agenda, as per the aims of the session today, the agenda includes me talking for the first 20 minutes, followed by getting some patient perspective from Patricia, who's going to give us her experience on how is it to both receive and provide peer support to other patients. Eleri is going to talk about what's the journey like and what's happened so far. We got some presentations from Stephen and Sarah on what's available nationally from NKF and Kidney Care to help with peer support. Then we're going to have some presentations around experience from different people setting up peer support both at a center level as well as at a regional level. And then we'll close the session hopefully by 4 o'clock. So what's the evidence for impact of peer support on promoting home therapy? So there is no direct evidence linking peer support either to hard outcomes like it improves patient survival or increase in the uptake of home dialysis, but there are lots of benefits from a patient perspective, both around the emotional and mental well-being. There is some evidence that peer support also improves treatment adherence. For example, patients on hemodialysis have less fluid gains and improved blood pressure control, which often healthcare professionals are very much interested in. But there are lots of benefits from a patient perspective in terms of the overall mental and emotional well-being. More recently, this is not yet published, as I was at the EuroPD conference last week where this findings were presented. This was probably one of the early or first studies to actually suggest that peer support might actually improve uptake of home dialysis. This is one of the factors that was associated with high home therapy uptake in those centers within the UK who were actively promoting home therapy. So hopefully in the next few months, there will be a publication coming out, which will be probably one of the first studies to demonstrate a direct link between peer support and increased uptake of home dialysis therapy. So what are the national levers in terms of why should we be providing peer support? So the GIRFT report, which was published in 21, clearly recommended that every center in the UK should be aiming to achieve 20% of their dialysis patients to be on home therapy. And they clearly recommend that centers should be working together with each other rather than working in silos in all aspects of promoting home therapy, including peer support. As you can see at the bottom of the slide, there is recommendation number 10, which clearly emphasizes the importance of ensuring that patient experience and shared decision making are central aspects of any service delivery. So how do we measure that patient experience? We already have an existing portal that does that for us through the UK Renal Registry PREM survey. And these are results from the most recent report, data between 2020 and 22. There are, I think, about 13 themes where questions are sent out to patients across all the dialysis units. And as you can see here from the bottom from the bottom of that graph, patient support is scoring very low between 2020 and 2022. So it's one of the third lowest scoring items on that particular PREM report. So within patient support, there are 3 questions that are asked. One is medical issues resulting from your disease. The second question is around concerns and anxieties resulting from the disease or actual treatment. And the third question is around accessing patient support groups. So as I've shown earlier on, patient support was one of the third lowest scoring items on that particular report. And within that, access to patient support groups was even lower. So about, as you can see, more than 1/3 of the patients have probably never had any access to patient support groups. So clearly there is gap that needs to be addressed. And if we are doing the PREM survey, there is no point doing a survey if we're not acting on it. And clearly patient peer support is one that will fill this gap or address this gap. So what are the other national levers? More recently, the RSTP Toolkit was released. And one of the recommendations is to that all patients should have access to peer support groups, which is aligned to patient age, background, and cultural belief systems. So what did we do? So going back to a year when DAYLife was launched back in 2022, we took a slightly different approach because we've been trying to promote actively home therapy across the UK for the last 5 to 10 years. And clearly we haven't made a huge impact apart from about a handful of centers who have a large number of their patients on home therapy. So we had to take a slightly different approach. So what we did was we went out asking patients first as to what they think are priorities for us as healthcare professionals to act on to actually enable home therapy to whoever is suitable for that. And so we took the approach of co-designing this with patients and healthcare professionals back in 2022. And we organized a series of events to do this. We started off back in March 23 with a patient event, which was held through, it's an online virtual event where we had about 30 patients. Some of you might have been part of that as well, to ask patients what they felt are key priorities for us as a national working group to promote home therapy. And the 4 areas that we chose are our priority areas will be shared care. We had a webinar on this back in September. And the next working area or priority for us would have been peer support, and followed by patient education and shared decision making and psychosocial support. So we did produce a report from this, which is available in the public domain and is available on the UK Kidney Association KQIP website. So we then followed on with the leadership event where we had about 60 healthcare professionals joining us to discuss the recommendations from the patient event, to understand how we take these recommendations forward, and also to understand the challenges from a care professional point of view as to what we should be doing nationally to support clinical teams to enable home therapy as a preferred dialysis modality. So we then had 2 webinars. The first one was the shared care webinar, and this was the second of the series of webinar to share the learning and the development so far around DAYLife. So recommendations from the patient event held back in March 23. There were 2 main themes that the discussions were around. One was accessing peer support, and the second theme was around governance and training. So I will let you read some of the quotes from those discussions from the individual working groups. So these patient codes refer to the issues around accessing peer support as experienced by patients from some centers. I'll give you a minute or so to read through those codes. As you can see from the bottom quote, that's an experience of a patient who has to actively ask to be introduced to a peer support group, but still didn't get that access in a timely manner and had to insist on getting that support. And eventually he did feel better having had that support to help him make the right choice. So the second theme within that was around governance and training. So a lot of people have expressed that it was difficult to set up peer support group because of the bureaucracy and the red tapeism around it and the governance requirements to set up peer support group. And they needed some form of a national strategy to deal with those sort of issues. And you can see from the bottom quote, one of the peer supporter actually is expressed, although she felt very comfortable doing that, she was slightly anxious about giving the advice because she needed proper training, which reinforces the fact that when we do offer peer support, the peer supporters needed to be supported and trained appropriately so that they give unbiased advice. Okay, so these are some of the recommendations from the patient event. And the first one was about proactively offering peer support to everyone. And this should be offered frequently. It's not a one-off thing. It should be offered frequently and as often as is needed throughout a patient's journey with chronic kidney disease, going on to dialysis, and even whilst being on dialysis and eventually having a transplant. So it's sort of done on a more regular basis as required by a patient based on patient's needs and demands. The second recommendation was there should be a wide range of formats as each person is different. So we need to tailor the way we support them depending on the needs. So they suggested different formats, including face-to-face, online. It could be one-off or it could be a group session. So we need to think about how we provide that and what is the best way of doing that. The third recommendation was, as I mentioned earlier, there should be some level of national coordination and leadership so that individual centers are not struggling to set up something on their own. Sorry, my slide is not moving. Yeah, okay. So we then looked at the recommendations from the leadership event. What care professionals thought was they needed a bit more evidence around value-added care and the cost effectiveness of peer support so that we can use that as lever to take it up to NHS England and commissioners and see whether we can develop a long-term sustainable model of providing peer support. They also suggested that there is already existing resources that needs to be developed further, especially the peer support toolkit hosted by Kidney Care UK. We'll have a bit of a discussion around that in one of the sessions later on. And others felt that there should be some form of national peer accreditation service so that volunteers can be trained appropriately and there is some governance structure around it. And again, people felt that individual centers are struggling to do this on their own. There might be some help provided regionally so that volunteer training and support can be provided at a regional level rather than doing it at individual center level. So just to give an idea of what KQIP does, these are the renal networks that are supported by KQIP, highlighted in green. So we've got program managers working in these networks to support various quality improvement projects, including home dialysis therapy. And what we are hoping is nationally, as part of the DAYLife, we will have working groups established and we will be able to develop and test some of the ideas in those networks through the support of program managers and the interested clinical teams. So what I would like to do now is just to ask people's views and thoughts on some of the issues around peer support. So if you could go on to your Mentimeter survey. So if you haven't done this by now, so if you could use either the QR code or if you could log on to that website and use that code, please. And that will bring up the first question, which is, do you routinely offer to your patients peer support by trained volunteers through either local or regional services? So as you start filling those, Kay will be able to share the responses for us. So does anyone need the code? I'll go back to my previous slide.
It's in the chat box, Uday.
It's in the chat box. So it's 277846558.
Hi, sorry, Uday, that code isn't actually working. I've put the correct one in the
Oh,
chat
is it?
box.
Okay.
But if you want me to share my screen, I've got it loaded
Yes,
up.
please. Yeah. Okay. I'll stop sharing. So there are a series of questions within that. So if you answer the first question, and Kay will real-time share the responses for us. Excellent. We'll give it another few seconds. So we got about 88 people registered. We have had only half of that responses. So could I please encourage everyone to complete that, please? It would really be useful to get a much more broader perspective.
It might be worthwhile noting actually, Uday, as well, that we'll keep the link will be open for the whole of the webinar.
Sure. Yes. So if people have had problems accessing it now, please do complete later on, because we will look at your responses, because this will help us inform plan further work going forward as a working group. Great. So we got 50-50 roughly response. So 50% of the responders so far haven't had the opportunity to offer that. So which nicely sort of takes us on to the sort of next session by Eleri. So there are other questions on that Mentimeter survey. So please do complete those questions as you go through the webinar, because we'll have about 10 minutes to look at the responses from those questions at the end of this webinar. So please go through those questions right through the webinar. So I'm going to hand over to Patricia next, who is going to give us a patient perspective on how is it like to receive peer support and also to offer peer support. Over to you, Patricia.
Hi, good afternoon, everyone. My topic today is how peer support helps home therapies. And as our speaker just said, my name is Patricia Gooden. Next slide, please. I'll just tell you a little bit about myself. I'm a double transplanted kidney patient. I've had 2 rounds of peritoneal dialysis, so I understand it fully. I had no prior information regarding PD before I did it. I don't know how I started. To this day, I don't know. I just know I ended up doing PD. I was fearful, and I put fear and trepidation because I didn't know anyone who'd ever been on dialysis in my life. I had little or no support, and I don't mean from family, I mean from the hospital. Not much education, didn't know what was going on. And when I actually started PD, my daughter had just moved to university, and I was in a house all by myself. My adult son had moved out. I didn't know what to do. So I went to my GP and asked if there's anybody else in the area who's doing PD, if she could provide a link for me, and she knew no one. And going through the isolation, I made a vow, and that vow was that if I know anyone in the future who is going on PD that I can help, that I would do it. The words peer support didn't come to me at that time. I'm going back over 10 years ago, but I just knew I was going to put myself in a position where I can help others. Next slide. So I put here, who is and I put a kidney patient peer supporter, because we have peer supporters in all areas, I think, but I'm talking about kidney patients. So for me, I thought it was an individual who has experienced kidney-related health issues. Someone who's able to share experiences, and I am able to do that. Someone who's able to provide emotional support. I think I qualify. When you have 2 children, a boy and a girl, where the boy is 12 years older than the daughter, but the daughter thinks she's 20 years older than the one who's 12 years older, then you know what emotional support means. And I think I can give that. I'm able to dispel myths, again, coming from a Caribbean background. Actually, I grew up in Jamaica in the Caribbean, and people are very superstitious and believe in a lot of old wives' tales, we call them, and I'm able to say, no, that's not true, that was made up by so-and-so. So I'm able to dispel myths. How to reduce feelings of isolation. I can write the book on that because I was so isolated, so alone, but I learned how to reduce those feelings. Information exchange. I read a lot. I informed myself. I empowered myself. I joined organizations that would give me the information I wanted. So I'm able to exchange information. And more importantly, I think it's important as a peer supporter that I portray myself as someone who's going to go on the journey with the person. I'm not going to stand behind and push them or stand in front of them and push them back. I am going to go through it with them. Next slide, please. Why did I become a peer supporter? I have personal experience. For example, I put traveling. Not a lot of people know that when you're on PD, you can actually go on a cruise, which I did. The machine comes in a suitcase, and I wheel that suitcase on that boat as if Christ was coming the following day. I organized it, took me 6 months. I worked with a hospital travel organizer. All my fluids were delivered to the ship, etc. People don't know. So I have the experience of that. I provide a positive outlook on managing kidney disease. Even though it was an illness that would change my life forever, I remained positive, because if I didn't, I don't think I'd be here today. I can offer empathy because I've been through the situation. I can share coping strategies. Yes, there are days when you might feel down, or there might be a night when your machine isn't working, or you might get an infection, etc. I can actually share how to cope with that. I'm also able to empower patients. I do have the ability to speak to people on a level that can always encourage and empower. And something that I find really important was to enhance adherence to treatment. I would sit in groups and I'd hear people saying, oh, miss that part out. You don't have to wash your hands a second time when you're doing the machine. And I would say, no, you have to do it, or else you can get an infection. And that infection will give you the worst pain ever. I remember I had an infection once. Can't remember the name of it now, but those are on PD. And it was worse than giving birth to my 2 children. So I was able to say, look, no, don't skip any part of it. Follow what you've been trained. Okay? And as I said before, I made the vow and I'm following it. Next slide. So I looked at home therapy and I looked at peritoneal dialysis, which is what I did, and I'm very familiar with it. As I said, I did 2 rounds of it. Some of the advantages: regular visits to a dialysis unit are not required, okay, because it's done all at home. You arrange your own times for therapy. I used to go on my machine, say around 10 o'clock, and I knew I'd be off at 6. By the way, it's every night, 9 hours per night. So every night, 7 nights a week, I did PD. So I worked out, and if I had to go to a meeting the following day, I knew to go on earlier. One day I went on at 3 o'clock so that I could come off early to leave out the following morning, okay? There are fewer restrictions on diet and fluid intake compared to those on hemo. Again, something that was really important to me and to many people is in the comfort of your own home. You don't have to go into a hospital. You don't have strange people around you. During COVID, I didn't have to worry because I was in my own home. Also, the Baxter nurses provide training and ongoing support, and they are really good. I can call them at any time and I know I'll get the support. Plus, there's an online American number that you can ring 24 hours a day and you get instant support. All supplies are delivered to your home according to your needs. So when I lived in a flat years ago, they would come every 2 weeks. Whereas when I moved into a house, they would come every 4 weeks, and I'd get all my supplies, every single thing I need to have therapy. Another advantage of peritoneal dialysis to me was I always had my family members around me. So if I forgot to bring a cup of tea up to my room or whatever, I could always call one of my kids to bring something, or, you know, just having them around was enough. Knowing someone else is in the home in the end. When my daughter left, you know, I did feed it, but when she was around, she was helpful to me. Another point I'd like to raise is that there are technicians available in certain areas, particularly when my mobility started to fail. I had a technician who'd come every single day because it was difficult for me to bring the fluids up the stairs and bring the boxes down and crush them. I said in certain areas, because I don't know if this is nationwide, but certainly under my hospital, the Royal Free, I had a technician provide me throughout the entirety of the second round of PD. The first round I did it myself because I was able, but when I became less able, then I was able to get help. Next slide, please. And I've given you a photo here of the peritoneal dialysis machine. I don't think it's changed in 12 months. It's 12 months exactly since I had my transplant. I hope it hasn't changed. And if it hasn't, then I hope that's the right one. Thank you. Next slide. So I looked at hemodialysis, home therapy too. You have short and nocturnal home dialysis, and this is what I researched. This is what I've been told. It's been reported that people on hemo or home dialysis take less medication to control blood pressure and anemia. Again, this is what I researched. Less medication to keep phosphorus under control to prevent bone disease. And if there are clinicians here, you can send something in the chat and tell me if I'm right or wrong. You can schedule treatments to fit your routine. Like what I said earlier, if I knew what time I was going out, then I'd adjust the timing of my therapy to suit me. Again, comfort and privacy of your own home, which really helps the healing process, and it helps you psychologically. Home dialysis makes you feel better. There's no hanging around for transport. Believe you me, I had to wait for transport once. It was around 4 hours. You know what? It was easier to send for my daughter who were living in Essex to come all the way to Hampstead, London, the Royal Free, and take me home before the transport arrived. So no hanging around for that. Also, I've been told you have a better quality of life because you're in your own home. Finally, again, I've been told people live longer when they do therapy at home. Next slide. Again, I've got a picture. I don't know if these machines still exist. I think this was the next stage one. I'm not 100% sure, but I just tried to find something to demonstrate the home machine. Next slide. And you'll be pleased to know I'm nearly finished. So what I've done, I've just given you a snapshot of how peer support helps home therapies. And what peer supporters do, you should provide the facts as you know it. So if somebody asks you a question that you don't know, be honest and say, I don't know. However, I can tell you A, B, C, and D. Empower patients to make up their own minds. I've had people ring me to say, what do you think I should do? Should I do PD or should I do hemo? I present the facts and I tell them very nicely, you need to make up your own mind. I didn't have that chance, to be honest, because when I went to my low clearance clinic, I won't name the hospital, it wasn't the Royal Free. I was living in North London then. They said to me that I would never be able to do hemo because I'd had a cesarean nearly 20 years before. To this day, I don't understand that. So how I ended up doing PD, I don't know. But there you go. Empower people to make up their own minds. Encourage patients also to empower themselves. So I usually tell them to join their KPA, or I refer them to the charities, Kidney Care UK, Kidney Research UK, the NKF, to read leaflets, to ring them up. And I tell them to read as much as you like, go on Google, see what you can find. And if you need more information, then come back via the charity. Okay? I've said here, remember, You, the peer supporter, you are not an expert. So don't pretend to be one. Just give the basic facts. And I can't overemphasize that. As I said earlier, signpost patient back to the organization. I currently work as a peer supporter under the National Kidney Federation. So when I support someone, I point them back to the organization and I give feedback to Steve, who runs the service. And lastly, and I'd like you all to do this with me before I go to the next slide, I'm going to count to 2, and I want you to hold your breath till I count to 2. Everybody. 1, 2. Now breathe, everyone. And that's the last thing I want you to do as a peer supporter. When you finish supporting someone, breathe. Please. Next slide. I want to give special thanks to the National Kidney Federation. They've given me this opportunity. Kidney Care UK. I honestly didn't know Paul Bristow was going to be here today. So it's a good thing I was being kind. I'm currently working on a joint project with Kidney Care UK. Kidney Research UK, I call them my second family because I was there with them in Peterborough on Sunday night at an Advent service. You know, I just get involved. And lastly, but not least, the Royal Free Kidney Patients, the Royal Free Hospital Kidney Patients Association, they have prepared me for the kidney world. Next slide. Thank you for listening. Any questions, please put them in the chat. Thank you.
Thank you, Patricia, for a very inspiring talk. And clearly you've shared your experience journey on how difficult it was for you to access peer support, and the lack of information and knowledge can be very distressing, and how you turned it around and actually started providing peer support and how others would have benefited. Certainly, I think there are patients who might have joined this webinar, and you clearly, I can see, inspired a few people, and you may have more peer supporters joining us nationally to deliver this service. Thank you. So in the interest of time, we won't take any questions, but please do put in your comments in the chat box. We're going to move on to the next session, which is by Eleri on where we are, what's the journey has been so far on peer support. Eleri has done a lot of work and has led a lot of national projects on peer support. And over to you, Eleri.
Thank you.
Oh, you're on mute.
I know, I'm trying to. It's
Looks like we've lost Eleri. Let me see.
Is it worth Uday, Stephen starting with his presentation?
Yeah, let's move on unless Eleri joins us. No, I think she might have lost the connection. Let's move on to the next presentation. So, Stephen, are you happy to do your presentation now? So Stephen is from NKF, and he's going to talk about the peer support service that's offered through NKF National Helpline. Over to you, Stephen.
Yeah, thank you, Uday. So I'd just like to welcome you to my presentation about the National Kidney Federation Peer Support Service. Next slide, please. So there's a little bit about me. I'm one of the NKF Helpline advisors. I'm also the lead of the peer support coordinator service we've got. I've worked for the NKF since 2017. I have previously done 8 years as an inside hemodialysis patient between 2 kidney transplants. My second kidney transplant is now 12 years old. And as I said, I am the lead of the NKF Home Dialysis Peer Support Service, which was launched back in September 2021. Next slide, please. In 2013, the NKF produced a home dialysis manifesto report to increase the uptake in home dialysis. In 2020, at the height of COVID-19, 7 years on from the original report, showed that there hadn't been much advancement in the amount of patients on home dialysis. So the NKF then held a webinar to discuss the home dialysis and effects of COVID on dialysis patients. It then came to light that patients who were dialyzing centre were catching COVID whilst having to leave their home to receive their life-saving treatment. So as a result of the webinar, we produced a report with clear recommendations to improve access to home dialysis and commenced a 5-year campaign to produce a yearly report. Our yearly report statistics and data show that for how each hospital is progressing in each area of England, Northern Ireland, Wales and Scotland. So all the statistics come from around the board and we put those all together and we put these in our annual report. So we have now completed 3 of these reports, which one was in 2021, one in 2022, and the last one, which was done this year in 2023. Next slide, please, Georgina. So to help increase the number of people having home dialysis, NKF launched our National Peer Support Service in September 2021. We then, the NKF looked to find volunteers who have had experience in home dialysis, whether this was home hemodialysis, peritoneal dialysis, or if there was actually caring for somebody who was doing home dialysis. So, and then we gathered all these supporters together, and then they were all given professional training to be set up to take part in our service. Next slide, please. So all of our NKF peer supporters have been fully trained. They've gone through fully professional training. They've gone through all the guidelines, and they're all, you know, they're all experts on home therapies, whether it be home hemodialysis or peritoneal dialysis. All our peer supporters are DBS checked. They are all ages range from 25 to 80-year-old. All of those have experience in all aspects of dialysis. So whether that's, like I said, peritoneal dialysis, home hemodialysis, or actually caring for somebody. All of our peer supporters, so following the guideline, they never give out their personal details out. They are scattered all around the UK, so covering all types of different areas. And this service is coordinated by the National Kidney Federation helpline. Next slide, please. So another type of support our peer supports are able to give is some support on shared care. Nearly all of our peer supporters have got experience in giving and doing shared care, whether in the hospital. So we are now able to offer that kind of peer support as well. A shared care peer support can include just measuring your weight, measuring blood pressure, measuring temperature, setting up a dialysis machine, preparing their own dressing pack ready to put on dialysis, program the machine, and one of the hardest parts, I suppose, would be inserting or removing their own fistula needles. So we think it's very important that our peer supporters know about this, because a lot of patients now who are wanting peer support, they're very keen to take control of their own treatment, and play some part of it. It may be only 4 of those points. They may want to decide to do it all, which leads them into being able to speak to their trust about getting set up for home dialysis. So the next slide, please, Georgina. Right, so how do people access the peer support service? So the main contact will be to the helpline, which is 0800 169 0936, or they can email the NKF helpline, or there's also a peer support referral form, which is online. So when the NCAF helpline is contacted by a person who's looking for peer support, the helpline evaluate the query at hand by reviewing the completed referral form that outlines the person's details, and then they will determine which peer supporter will be the most appropriate to match. So what we do then, we look at our peer support volunteers and we come up with the ideal volunteer who we think would be helping the patient we've had from the original inquiry. Next slide, please, Georgina. So once the peer support has taken place, we run the feedback service. So the NKF peer support service will contact both the peer supporter and the person who received support for their feedback. This helps us monitor the service and see how well it's running, and to make sure both parties are very happy. We've done around 90 of these peer support surveys so far, and we've all had good feedback. Our peer supporters are very passionate at what they do. They're very keen to help people and support them in any way they can, whether that's been going on home dialysis, home peritoneal dialysis, home hemodialysis, or if they're even just thinking about going in centre. They can also help people who are not quite sure which dialysis route they want to go down. So somebody's function may be getting low, they've been to pre-dialysis clinic and they find it all a little bit daunting and they're still not sure which one to do. So we can then, our peer supporters can then help them make the right decision. There are sometimes occasions when people want to speak to the same peer supporter they've spoken before to the previous outline, so the NKF outline, they'll be able to set this up. But we've had this a few times where patients have not quite started home dialysis or they've been thinking more about it and they would like to speak to the same person they spoke to before, which I think really helps and benefits. And we've had quite a few of these, and some of them have done 3 or 4 with the same patient, which has led to, leading up to the journey to them starting, whether it's be in centre, home hemodialysis or peritoneal dialysis or caring for somebody. So it's really valuable that, they can contact and speak to the same person and make that link. And next slide, please, Georgina. So the NKF Peer Support Service has worked very closely with Diverum, Fresenius Medical Care to educate their staff about our peer support service, to promote in their units by offering support and telling patients about our NKF service if they are showing an interest in home dialysis. So, we're very pleased to have Diverum and Fresenius on board with us. So they're back in the service. Many of the units have now got posters up promoting our service, and the staff are, and the staff are aware of the NKF service, and they can pass that on to patients who may be thinking about doing some type of home therapies. We've also got a very good working relationship with Hertfordshire NHS Trust, who have been sending their peer support referrals to the NKF helpline, and we've been very pleased to help Jackie out with her peer support service in her region. So, slide 10. So just to recap all that, the National Kidney Federation and Home Dialysis Peer Support Service is an excellent resort for anyone affected by kidney disease or is considering or currently undergoing home dialysis or shared care. As I said, the contact to the NKF helpline for the peer support service is 0800 169 0936 or the NKF email helpline@kidney.org.uk, or you can visit our website to access the referral form on home dialysis peer support information leaflet at the link below. So I think that is me done. Thank you, Uday, and everybody for inviting me along today to do the speech.
Thank you, Stephen. I think there are a lot of healthcare professionals and the webinar. So all that they need to do is pass on your details and the helpline number to patients. And it's more about offering it to everyone, isn't it? You don't have a limit in terms of how many you can support at a particular time. So it's us care professionals offering this service to everyone who they meet, and it's up to the patients to then to choose whether they want to contact you or not.
Yes, that will be fine. If they promote us and say to the patient, are you aware of the NKF peer support service? pass on the details, and the patient can call or email or fill in the referral form on the website. And the 23 peer supporters cover every scenario, so we will be able to help every patient who wants to know about home therapies.
And it doesn't take much time from a professional point of view just to pass on the details rather than holding on to the details, isn't it? So it's a great service. Thank you, Stephen, for summarizing that.
Thank you.
Again, if people have any questions or comments, please do put it in the chat box. I'm going to go back to Eleri. Now I can see she's joined online. Are you okay to do your presentation now, Eleri?
Hopefully
Thank you.
Teams is Teams playing nice with me now. Can you hear me?
Yes.
Yeah, just completely froze before. My apologies. So I think we've just fallen slightly behind schedule, so I am going to talk quickly. I'm going to give you some information about sort of the journey so far. So we're going to talk about where we started in kidney care, peer support, where we are now. But actually, the first thing that I want to mention is where do we want to be? Because that's really important to know why sort of where we are is important and what we're going to do next. Certainly we want high quality peer support to be frequently promoted by clinicians, available easily in a range of formats to everyone in the UK affected by kidney disease and at all stages of their kidney journey. Because even though DAYLife is focusing on home therapy, so therefore you might think, well, peer support needs to be given when people are making decisions or on home therapy to help them sustain that. Actually, peer support lays a really good foundation for people to be empowered, involved, engaged in their care. And the earlier you give it in a patient's journey, the more likely they are to be in a good position to consider home therapy. So it should be available at all stages. But that's where we want to be. Where did we start? Well, from a personal perspective, back in 2005, I was a junior nurse and I happened to be in the right place at the right time when King's College Hospital, where I work, started to set up a peer support service, which was at the request of our patients. And we were lucky enough to have a sort of charity fund at the time, which we could use as some money to get it going. Back in 2005, there was not really any guidance. We weren't the first people to do it, but we were one of the early adopters, so there weren't other people who we knew of who we could approach to learn from. So we were really trying to do it all by ourselves. And of course, anything if you're trying to do it in isolation is very hard. And that's what lots of other people who've tried to do peer support by themselves have found over the years. It is becoming more part of the national conversation. And in the early years, some exciting things happened to move peer support up the agenda. One was a sort of really valuable piece of qualitative research, which I was a very junior member of this team, and it taught me a lot while I was doing it. But it was asking people who'd had peer support when they were making decisions about dialysis choices. It asked them, well, how was it for you? What did you experience? And it really helped people to feel less isolated, to feel normal, to be reassured about making treatment decisions. And the quote, which I think is particularly valuable when we're talking about how peer support can help people feel confident in choosing home therapies, is here. The other thing that was helpful in the early years of peer support was NHS Kidney Care, which was a sort of government quango organisation which ceased to exist about 10 years ago in the bonfire of the quangos. But it was really, really helpful in those early years, in the late noughties and early teens, by helping to support 2 pilot projects of setting up peer support, which I think were in the West Midlands and in the North East, pulling together reflections and evaluations of how to start a peer support service and publishing those reports. It conducted a survey to see where we were at and what the barriers were. And I'm sure that if NHS Kidney Care had continued to exist, that we would be further on than we are now. Because unfortunately, through the teens, of course, we had austerity in the NHS. Peer support was a nice to have, not a fundamental sort of commissioned part of service. And unfortunately, things certainly stagnated. And for some of us, they went backwards. I know in our unit, our kidney peer support service did take a couple of steps backwards. And that's commonly what I heard over a lot of the country. This graph shows you the results of 2 identical surveys which were conducted in 2012 and 2019, asking kidney units, what sort of peer support program they have. And as you can see, the situation did not improve. The peer support was not more available in 2019 than it was in 2012. And that was despite lots of sort of policies recommending that peer support should be a fundamental service component and that people should have direct access to expert patients or peer support. But just saying that, it's helpful, but only up to a point if people who've got the money are not saying, yeah, but we're going to pay for it. So it still remained a nice to have. The evidence was building up, though, during the teens. And as Uday said, there's no sort of big randomized control trial that shows that if you give peer support, lots more people go onto a home therapy. But the ways in which it helps people do directly support self-management, home dialysis, and are certainly crucial elements of how you help more people be in a place where they can choose home dialysis. So the evidence is building up. One other aspect of evidence which I want to draw attention to is that peer support is particularly beneficial for people who we don't tend to help as well with our standard services. So people from ethnic minorities, people of low health literacy, or from lower socio-economic status groups, this kind of thing, they're disadvantaged by our standard services and they're less likely to go onto a home therapy. And there is evidence certainly outside of kidney care in other long-term conditions that peer support can really help these people who are normally disadvantaged become much more engaged in their care and pick up those skills of self-management that we want people to be able to have. Now, you've seen this already this afternoon as well. This systematic review, which very helpfully sort of, confirmed or concluded that people do benefit from peer support when they've got kidney disease. What Uday didn't mention is the second half of their conclusion was that peer support programs are underutilized. We know this. We know that there are not enough peer support programs, clinicians promoting peer support across the UK. So it's not available to everybody at the moment in an easy and readily accessible way. Why is that? So I've already told you some of the sort of system-wide issues and the barriers which stop individual people or individual units from building up peer support. They've been very consistent over the years. So various documents, various surveys have shown that the barriers have remained the same, more or less. And that is that other projects take priority, that clinicians have too little time to get peer support started and sustained, that clinicians have uncertainty about what should I be doing, how should I be doing it, that there needs to be more local leaders, local champions who are willing to say, okay, well, I don't know how to do it, but I'll give it a try. And obviously that's difficult to find people who are able to do that. And there was a lack of guidance as well. So those were very consistent in terms of what was preventing more kidney care being available. But there is good news. So since 2019, there's been quite a lot of change and quite a lot of development. We do now have national guidance, which is available freely to everybody in the form of the Peer Support Toolkit, and that is still being developed. You'll hear a bit more in a moment. You've just heard about the NKF Peer Support Service, which could and should be better utilised across the UK. At Kidney Care, at Kidney Week this June, you couldn't move for peer support being mentioned or sessions about peer support. So there is a lot of interest across the renal community at the moment about peer support. And I think that this is our opportunity to strike while the iron's hot and really to use this enthusiasm and this interest to make it happen now. We've been talking about it for years. It's been oh, well, that'd be nice, but I don't know how for years. But we've now got collaborations. We've now got people partnering. We've now got both national and local and regional leaders coming forward and saying, yeah, no, I want to be a part of this and I want to be involved. So I think we are closer to climbing that mountain and reaching this aspiration of where we want to be. And this afternoon is one of the examples of how we can work together to do that. And there's opportunities for other people to sort of get involved. If you want more of a leadership role, then talk to the people in your area or talk to myself. And, you know, the more hands, the better. Thanks very much.
Thank you, Eleri, for giving a nice overview of the journey so far. Clearly, you've shown how things have stagnated over the last decade, 2 decades, and is picking up a bit of momentum in the last few years. And I hope the DAYLife program and people who have been working on this so far will get that extra layer or level of support to take this to the next level. And clearly, there are not a lot of national levers to try and promote this. And clearly, we need more engaged patients and professionals to roll this out nationally. And I hope this webinar and the work we are going to do as part of the DAYLife will help us achieve that. Thank you. So again, in the interest of time, we won't take any questions, but please do put in your comments. For speakers, there are some comments specifically addressed to you. So if you do have time, could you kindly respond to those? If not, we will come back to those questions after the session, and we might respond directly to individuals. Thank you. So next, I've got Sarah, who's from Kidney Care, who's going to talk about the toolkit that's been in development that Eleri mentioned, and how things have been so far and where the future holds for that. Okay, thank you.
That's great. Thank you very much. My presentation just loading up here, so bear with me. But yes, I want to introduce you to the toolkit. What is it? How does it help you? And why did it come about? So, as it says on the tin, it is a toolkit. It's everything that you need to run a peer support program. It's hosted on the Kidney Care UK website, and it's freely available to everybody. So there's a whole suite of resources there that you can tuck into. When do you use it? Well, ideally, you'll go there as you're setting up your peer support program, because it takes you right through from the beginning through to the detailed resources that you need to deliver your program. But you can dip in any time that you need to. Who's it for? Primarily for people who are leading a peer support program within their renal unit. So specifically created for healthcare staff or the supporters that work alongside to make this happen in units. And how does it work? Well, it takes you through a series of questions and it offers you some templates for resources so that you can build your own peer support service. Oh, sorry. So how this came about? Well, it was created in response to the need to improve the peer support in renal care. As Eleri was just talking about, that project in 2019 that looked at where peer support had moved to and found not very far at all. That project also identified some of the barriers that were preventing people from setting up peer support services and therefore patients being able to access them. The project was run by Nikki Thomas and Eleri Wood, supported by Kidney Care UK, and the toolkit was part of that. Since then, it's been endorsed by the UKKA, who've produced an open letter of support for the toolkit and its suitability in renal settings. So if you're a coordinator who's struggling to get your hospital or your trust to allow you to go forward with a peer support programme, then there is some support there as well to underline the resources that you're using to show that the programme that you're going to implement is well thought through, it's tried and tested, and it's safe for patients. So it is a web-based resource, and as a web-based resource, you just scroll through, follow the links. You can download the sample documents that you need and use the templates that are freely available. It's divided up into several sections to take you through it step by step. So you really don't have to do any planning yourself, you just follow the toolkit. So before you start, is a really important place to spend some time, because that will help you decide your format and it will help you to promote your programme so that you can recruit people to volunteer, and also that you can let patients know that that's available. There's a section on recruiting and training, making sure that's safe and comprehensive. A section on how and when to refer, who to refer, the matching process, and getting that feedback. As well as those practical issues, there's interspersed in there different information and published papers that give that evidence base to the toolkit. So as I say, one of the most important things is the thinking phase, and it's really worth getting together with a group of patients ideally, and other professionals in your unit to work through these questions, because that will really help you define what you want from your service and how it's going to be set up. And then you move on to the doing phase. And as I say, that's presented in 6 different sections, and each section has these documents and templates that you can download and edit to use for your own program. So the content, I won't linger too long on this because we are in interest of time, but just to give you a flavour for the comprehensive nature of the content there. There is that program format, giving you different examples of how a peer support service could be set up and run, and how you're going to do it within your unit and the particular logistics that you have. The section on promotion is all about raising awareness, as I say, for recruiting volunteers, for letting staff know that it's happening, for letting patients know that it's happening. And again, there's editable samples that are available on the toolkit. Recruiting and training is really important, but things like a role description and a supporter handbook are right there so that you don't have to reinvent the wheel. Just pick up those resources and use them for your own programme. Plenty of downloads in terms of posters, recruitment, forms, those kind of things. And supporter training guide and slides. Importantly, it's looking after your volunteers as well, because once you've got people who are invested in that service, it's keeping in touch with them and making sure that they're happy and comfortable, and that they have everything they need to deliver their service confidently. There's a section on referrals, and this is one of the key things to think about is who to refer. Is everybody suitable for peer support? Possibly not. And you have to decide whether your programme is going to offer a certain treatment modality. For example, is it transplant patients? Is it all patients? But also to know where to signpost patients to who may not be suitable for peer support, but do need that extra information and support. So our patient support and advocacy officer at Kidney Care UK, for example, would be able to give a little bit more in-depth help in that situation. There's a section on the matching process. Who's responsible for matching in your unit? It is a time-consuming process. Finding the right people who have the right kind of experience are going to be able to help somebody is not something that's really done terribly well by computer. It is about knowing the people that are part of your program. So think about that matching process and how that's going to work for you. And then finally, most important, evaluation and feedback, to know that the people who've come to your programme for support have received that support in an appropriate way, and they're happy with the answers that they had, and equally that your volunteers feel supported and they feel that they've done a good job. And just before we leave that, most recently we've set up a WhatsApp community for peer support networks. So one of the barriers was, yes, having the resources to be able to create your own peer support program, but another one that comes up quite frequently is it's a very lonely place to be, trying to set up a peer support network within your own unit or trust. And so we have created a shared space, a community on WhatsApp, where leaders of peer support programs or people starting up peer support programs can come together, share their resources, post their challenges, commiserate with each other and celebrate with each other. And you're very welcome to be part of that. Just email peer support, or one word, at kidneycareuk.org, and we can get you included in that WhatsApp community. And that's me. Thank you very much.
Thank you, Sarah. I was going to ask you about that connecting people, and you clearly answered that question in your last slide. Just one quick point for the benefit of people attending who might be thinking of setting up a peer support. Do you provide any sort of personal mentorship coaching for people wanting to set up peer support, or do you just they use the resources and get on with it and use the connecting group?
Yes, it is use the resources, but please do get in touch with us, because we can put you in touch with other people who've been through this, who can share their experience. Peer support for peer supporters, it's invaluable. So yeah, we're here for that.
Excellent. So we're going to move on to the next presentation. I think this is from Louise from Oxford, who actually is setting up a peer support service in Oxford, using your toolkit, I suppose. And over to you, Louise. So this is just to share her experience of setting peer support in a single centre.
Thank you. Can everyone hear me? Can anyone hear me? I hope so.
Yeah.
Yeah, great. Okay, so yes, thank you, Uday, and everybody. We have used the toolkit. So thank you for that. So I'm going to talk to you about our journey here in Oxford in setting up a peer support service, like why we did it, how we're getting on, where we are currently, and what our plans are moving forward. So I'm the clinical psychologist in the team, and I've been on a mission to set this up probably since about 2017-18, and this is how long it's taken. Linda Evans, our kidney patient advisor, is also involved, and I'm going to be handing over to her in the new year, where she'll sort of take more of a lead for it. And we also have Mia, who I hope is on this call today, who's an assistant psychologist, and she's also helping coordinate a lot of the service at the moment. So why are we setting it up? I don't need to repeat this, really. We know that, I'm a psychologist. People don't often need me. They don't need therapy. They just need to talk to somebody else who's been through it, who gets it. And, that can be the most helpful thing very often. And we also, in Oxford, we had a lot of informal patient support. So, if I asked a nurse, could you recommend a patient? Or they'd say, oh, we've already done this. So it was happening informally, but I just really wanted to formalise it and therefore make it accessible to as many people as possible, and to also ensure that there was proper governance in place. So, and I also spoke to other people. We have a very amazing peer support service here in Oxford within our HIV service that was winning awards. So we started talking to them and really got inspiration from them and other services. We also ran a service improvement project here in Oxford with our low clearance clinics. And one of the findings from that was that we should be offering matched peer support to allow patients to meet others with the same condition. So everything was pointing in this direction. I knew it was what we needed. It was just, did I have the time and the energy? It's quite reassuring to hear other people say that this is hard work, because it does feel like hard work. So I'm realizing I can't actually see my own slide because it's very small on my screen. I don't know what to do about that. But so our model is that we would find people and we would match people according to the stage they're at as closely as possible. It will have, I can't even read my slides. Peer supporters will have this isn't good, is it? Hang on a minute. I'm just wondering if I should stop sliding in this format, sharing in this format. Hang on one sec.
We can see it okay. Sorry,
I know
if you
can
can't.
see it okay, but if I can't read what's on my slide. So can you all bear with me for 1 minute with this technical hitch? I've been sharing it in a particular mode, and I'm just going to share it in a different mode. So now you can see it, can't you?
Yeah. Louise, if you just do the slideshow from current slide.
Yeah, that's exactly what I'm about to do. So I can see it now. Can you all see it as well? Yeah. So peer supporters will give us a short bio. So during the training, we have a chat with everybody, find out a bit about them. So we're collating a very short, just a few lines on what it is that they're interested in and what their renal and transplant journey has been. So at the moment, we're only allowing referrals to come through staff members at this stage. Patients will be contacted within 2 weeks of a referral being received, so that we can get Mia, the psychology assistant, is going to have a chat with them a little bit more about what they're looking for. And we also have a code of conduct, which is because we are sharing personal details. We have consent to share emails and telephone numbers, but they have to consent to this, and they have to agree that these will only be used for contact within the context of the peer support. And our peer supporters sign a code of conduct, as do all people coming in. This can be done virtually. We have consent for verbal agreement as long as they've seen the code of conduct and consented to it verbally or signed it. The peer supporter will then be contacted and asked to make contact with the patient via the preferred method, and most of these are going to be virtual. If face-to-face, all contact has to be on trust premises, and we've asked that the minimum commitment from our peer supporters is an hour a month. After each contact, the peer supporters are going to complete a brief summary form and return it to the assistant psychologist, and we'll have regular meetings with myself and the kidney patient advisor to ensure that they're getting all the support they need if difficult things are arising from their meetings. We also send feedback forms to the patient who's been receiving the peer support. So what have been some of the, how have we done this? So finding and training peer supporters. So recruitment, we've gone through staff recommendations only at this stage. Potential volunteers are approached and given some information. We have a job description. I'm guessing all of this has come from the toolkit, which the previous psychology assistant I know used. They're given information about the role and asked if they'd like to find out more. And we have asked many more people than we have as peer supporters. And I feel this is a success because I feel like we're really giving them a full understanding of what it involves. And we can see that for many people, with all the stuff they have going on in their lives, taking on this additional role is possibly not necessarily the right thing at that time. Our training is for a half a day. I know other services offer much more training. I've seen some that offer like a day or 2 days, but it's on Teams and it's 3 hours. It's based on the model used in a spinal injury peer support service and our local HIV one. And we send out a workbook to people prior to this training session. And of course, alongside the psychological training around listening skills and going through various scenarios, they have to become a trust volunteer. And our psychology assistant has been critical in trying to push people through this process. And this process, of course, as many of you will know, involves getting DBS clearance, going through various, having to show proof of identity, all of this sort of stuff. And this has been quite overwhelming for a lot of people. Some people don't have access to scanners or printers or tech. And this has delayed us much more than I think we envisaged when we started this journey. So currently, where are we? We're moving people through the training. We've given 2 training sessions where we had 4 people at one and I think 2 or 3 at another. So I think we have about 6 or 7 who've attended the training. And we have a training session planned for January with potentially 10 people attending. The peer support group so far, and with these extra 10 people, will include people across the spectrum, from home hemo patients, carers, PD, hemodialysis, kidney and SPK transplant patients, and living donors. We really want to make sure that we're kind of making this as accessible to everyone and helpful to everyone here in Oxford. Supporting everyone to get through the paperwork. Currently, we only have about 4 who have completed everything. That's a sign of how difficult this has been. We managed to get it from a trust induction that involved everyone coming to Oxford for half a day in person, down to this sort of 3 hours with us. So, and it's still proving quite challenging. So in terms of our referral process, staff are going to complete a referral form via our electronic patient record system, which will come into a shared pool. And all this, we're trying to make that as easy as possible for staff. So it's literally all the patient info is automatically there, and we just want them to indicate the stage of illness that they're at. We're going to review these twice weekly. We'll then contact them, as I've said already, looking at their preferences around contact, what they want, who they want to, what it is they're looking for, and make sure that we're the right service for them. And then we'll share the contact information with a matched peer supporter. We have had many challenges keeping momentum going. So we had an assistant psychologist who left. There were then 3-4 months when not a lot happened. People were left in limbo. It hasn't been ideal. The trust induction process has been a real challenge. We've had to go through governance and make sure that we're not sort of, that we're keeping within governance and we're not sort of sharing patient information in a way that's inappropriate. Paperwork. So people don't have, as I said before, access to, we've got someone at the moment who's really keen to do it. She doesn't have a driving license. She doesn't have a passport. Finding financial support to help her get through that process and maybe get a replacement driving license, etc. Safeguarding. So the safeguarding training was a big issue from the trust. They wanted to make sure that everyone had quite intensive safeguarding training. Again, we've managed to share our own safeguarding training and it's been cleared as being adequate. Communication, a balance between us pestering our peer supporters and offering them support with this process has been hard. I know that the psychology assistant often feels bad phoning people and chasing them. Have you done the paperwork? But some people are grateful, some people perhaps less so. Also, of course, our volunteers have their own health stuff going on, so trying to sort of be sensitive to that. And, I have a very busy job role, as does Linda, the social worker. So at the moment, we're really running it kind of in the minutes in between the other jobs. And so we really need to think about sustainability moving forward. We really want to, I don't know if we've talked about that yet today, but really think about diversity and ensuring that our volunteers and our peer supporters match the patient population. And also, we're thinking about data protection and the sharing of contact info. That's been a real challenge, making sure that we were getting that right. And there's been lots of good bits. The enthusiasm from our volunteers, so many people are just desperate to do this. They really want to give something back. They feel like they've had dialysis support, they've had a transplant, and now this is their chance to really kind of give something back to others in a similar situation. There's clearly a demand for it. From patients and staff, but no one has the time to do it. Our training's going down really well. People are really enjoying getting in touch with others and building this sort of camaraderie amongst all the volunteers. This is our poster that I think is probably taken straight off the toolkit, which is what we're going to start using in January as we start. Our plan is to launch second week of January. We plan to have some sort of launch events inviting people within the wider MDT so that they start to understand about the service, to know about the service and how they can refer into it. So our goal is that this is a service that will be routinely offered to all new and existing patients within the unit and our satellite units, and that everyone in the MDT will know about it. At the moment, referrals have to come through staff. We want, if we get a more sort of sustainable staffing group to support the peer support service, then maybe we can start to take more direct referrals. We want to continue to recruit people into the programme as peer supporters to manage attrition. So our plan is to run sort of quarterly or 6-monthly training so that we can keep bringing in new peer supporters. To ensure that our processes are secure and documented so that if somebody leaves, we don't then have to sort of wonder what on earth is going on, but that we have this all sort of there so that we can then hand over to somebody new. And to offer ongoing support for our peer supporters. So our plan is to have some training days, some social events, and to offer regular reflective space and or supervision. We're going to use the peer support toolkit to look at how we can monitor and review feedback and hopefully audit this in about 6 months' time to see if we want to carry on or if there are changes that need to be made. And to recruit a broader team. So maybe I've really been inspired listening to everyone today. Maybe we need some peer supporters to run this for us. So I'll be certainly exploring that as an option moving forward. And that's it. Thank you very much.
Thanks, Louise, for a good summary of the challenges you've had. It's taken you 6 years to get here. Thanks to your perseverance and commitment, you were able to set it up.
COVID didn't help.
Yes, certainly. I think later on in the webinar, we'll be thinking about regional models because lots of centers are probably at a similar stage, and how we, as going forward, should be thinking about centers working together within a region to think about regional models so that every center doesn't have to go through the same challenges. It will be more sustainable as well in the long term. So that's a nice way of setting it up in a center, and how we also need to think about extending this to other centers at a regional level. So great, thanks for all your effort, and hopefully we'll look at sustainability within Oxford somehow to support your program. Okay, so we'll move on to the next session. So please do put in your comments in the chat box. Louise is still around for another few minutes to respond to your questions. We're going to move on to the next one, which will be from Eleri again. She's going to talk about what peer support training will be like. Is that, yeah, Eleri is going to talk about that. So what does the training for peer support entail? Eleri, please.
Sorry, right screen to mute myself. Okay, let me go back to my presentation. Great. So we know that one of the barriers for doctors and nurses and clinicians to sort of really be enthusiastic about peer support is worries about will it cause harm. So I'm going to tell you a little bit about the training, and the main reason why training is performed is so that the information that's given, the support that's given is positively received. We know from some evidence out there that peer supporters who aren't trained are more likely to give inaccurate or misleading information, and they're more likely to talk about things negatively. So minimizing that risk of harm to people and helping professionals therefore feel confident to engage and promote peer support are two of the most important reasons why peers need to be trained. The third reason is that peer volunteers themselves need to feel happy and confident in the role. They need to feel like, yeah, I know what I'm doing, and I'm doing a good job because I'm doing what I was told to do in my training. I'm going to tell you about the training program, which is available via the Toolkit. It has sort of 4 broad aims, though there's lots of detail in each of those aims.
Sorry, Eleri, for jumping in. I just can't see your slides. I'm not sure if it's just me.
Let me go again. Did you see them at first?
No, sorry.
Oh, you never saw them. That's fine.
I can see them now, though.
Excellent. All right,
Okay,
you've not
great,
missed
thank
anything
you.
so far. Okay, great. So this is the training which lots of units have used because it's available via the Toolkit, and it's what I've been using in London and in the London region in my unit, and whenever I've done training for other units or for the NKF. It can be delivered in 4 to 5 hours, depending on how big the group is, and it can be delivered face-to-face or online. It doesn't involve very much PowerPoint presentation. It's not death by PowerPoint, because we want people to really think and explore what being a peer supporter is. And the people who come forward as volunteers, they need to know, oh, what would I do in that situation? We can't give people a very hard list of rules of what they should or shouldn't do to give good peer support. So people need to get a feeling and an understanding of what peer support is and what the boundaries are, so that they can apply those boundaries and apply their skills in regardless of what situation they find themselves in. So this is roughly the things that we go through. Overview of the local programme after we've done some icebreakers, role and boundaries of peer support, listening, dealing with emotions, difficult scenarios, practicalities and signing up. So I'm just going to go into a little bit more detail on a few of those things. So in terms of the exploration of the role, we divide people into small groups and ask them to think about these questions and, you know, give some preliminary answers of what they think, you know, peer supporters should do or not do, or the kind of person they should be. And it's very interesting, the things that come out. And as a facilitator, I try to help the group talk around each question, and usually they end up coming to sort of the right conclusion. You'd have somebody saying something like, oh, I think a peer supporter should be honest. And someone else will say, oh, but I couldn't be honest about my time on hemodialysis. It was awful. And someone else says, but you can't lie about it. And hopefully as a facilitator, I don't have to say anything at all. Obviously, sometimes I need to step in and give a prompt or a guide, or certainly help people know when they've reached the right conclusion about how honest is the right amount of honest to be. So a facilitator is really important as a guide and a prompt. A facilitator of training shouldn't really be teaching very much. Once we've been through all those questions, we tend to explore and talk about what the job description is, and anything that wasn't picked up in that group discussion coming from those questions can then be raised and explored. We spent some time in helping people focus on listening skills. Now, there are two reasons for that. One is that people coming forward as peer supporters do need to get a really good understanding of how important listening is. A lot of peer supporters are naturally sort of outgoing. They're keen and happy to share their story. And we need to make sure that there's an understanding amongst volunteers that before you can share in a helpful, appropriate way, you need to have listened and understood the person who's in front of you, understood where they're at, why they've come there, what's happening for them, and what would be helpful for them to hear. So that's the first reason why we spend quite a while focused on listening. And the second reason is so that people get just a little bit of an idea of what effective listening is and how they can do it, and what shows that they're listening. And the discussion, we come up with a list of sort of listening do's and listening don'ts, and this is sort of an example of the kind of guidance that we would come together, conclude as a group, and then people will go home with those lists so that they can remind themselves when they're giving their peer support. The part of the training that as a facilitator I find most stimulating is when we talk about difficult scenarios. So these are sort of vignettes which we ask small groups to discuss, to think about what are the key issues that have occurred in that, and how would they go about dealing with that situation if that was to occur while they were giving peer support. I do stress and emphasize that these are very unlikely scenarios, though they, even though I don't think any of them have fully happened, lots of them have got kernels of truth in them, and they could all happen, you know, they're not impossible. To give you a flavour, scenario 4 talks about someone who's come for peer support but who says that they're going to stop taking their medication because they believe that God will cure them if they pray hard enough. Now, this tends to bring out issues around how to be respectful of people who you're supporting if you think that they're wrong about something, and if they've got different views or opinions to you about things. And this also brings up a very useful conversation about advice giving. So peer supporters should be very, very careful about giving advice. One of the concerns of clinicians is, oh, will a peer supporter give someone bad advice? Well, we need to help peer supporters know where is the line, what advice is okay to give and what advice should not be given. Of course, medical advice shouldn't be given, but it's okay to give advice which is standard and the same for everyone. So, for example, in this situation, you could say, well, you know, I'd advise that you don't stop taking your medicine. That's medical advice, but it's good medical advice for everyone. You know, don't stop taking your prescribed medication without discussing it with your doctor or nurse. So that advice we're happy for peer supporters to give. The way that I help peer supporters differentiate between bad advice and good advice is individualized advice. So talking about one particular medicine and saying, oh, that one you shouldn't stop, or that one worked for me and you should take it too. Anything which could be different from one person to the next, that is advice that peer supporters should refrain from giving. So that's the kind of discussion which comes out of this scenario. And then safeguarding was mentioned in our previous session, and that is a very strong theme on this scenario, where the person that you're supporting is having money problems and they say they can't afford childcare and are leaving their 4-year-old son at home on his own while they go to haemodialysis. Obviously a really worrying situation to come across, and it's crucial that peer supporters know about issues of safeguarding and about when they need to tell someone about the risk of harm occurring. And a lot of peer supporters worry that if they tell someone about this, they're going to be breaking confidentiality. So this helps us explore issues around, well, as a volunteer in the healthcare team, you are a part of the healthcare team, and therefore you can talk freely with other members of the healthcare team about the people who you're giving peer support to. Confidentiality is about you not talking with people outside of the healthcare team, and how when someone is at risk, either they're putting themselves at risk or they're putting someone else at risk, actually you need to tell someone, and sort of the normal confidentiality issues don't apply if someone is in danger. And I think also the important thing to help people understand as they go through the training is that they're a volunteer. They've got their own health issues. We do not expect or want peer supporters to take on the problems of the people they're supporting. So they've got to, if they identify a problem which is worrying them, they need to give that to the healthcare professional as soon as they can. And peer supporters should not be taking on other people's problems, taking on their worries, trying to solve their problems. They're not problem solvers. They are their supports. They can signpost, they can be empathetic, they can be a listening ear, but they're not there to solve the problems of the people who they support. And they need to share things with their peer support coordinator or the other professionals in the unit for their own sake and for the sake of the people who they support. The training has been evaluated, and we asked people to sort of fill in Likert scales for various sentences, both before they had training and after they had training, and that showed that they increased knowledge of assistance, understanding of the role, how emotionally prepared they felt, and their confidence in their personal skills. So we know that the training is doing a lot of what we want it to do. When we did this evaluation, one of the pieces of feedback that we got was that people didn't feel that they were skilled in responding to sort of really heavy emotions. They worried that if someone was really upset or really angry or really low, that they wouldn't really know what to do. So we've adapted the training a little bit, and it now includes a bigger section on sort of recognizing if someone has those emotions, dealing with them, and sort of what you can do if you think, oh my God, what am I going to say? So just helping people know, and we give them this list so that they can have it in front of them when they're giving peer support, so they know that if they can't think of anything to say, they can have a quick look and go, oh yeah, no, okay, it's okay to feel angry, or oh, it's okay for me to be quiet for a moment and just wait. And the feedback has been that people do find this helpful, so that they feel much more prepared to deal with big emotions that might come up. The training is iterative, so I'm always tinkering with it and fiddling with it and improving it. And I know other people use slightly different versions, but I think all peer support training sort of covers these same sort of areas. As we've said, it's available in the toolkit, along with PowerPoint to help you deliver it, and a handbook which then gets given to volunteers, which sort of contains the content of the training. All via the toolkit. Thank you. That was a whistle-stop tour of the training.
Thanks, Eleri. I think you've given a very clear demonstration of how comprehensive the training for peer supporters is. Hopefully that will allay some of the anxieties and concerns for professionals who are reluctant or hesitant to refer patients to peer supporters. So maybe as a group, we need to nationally think about how we standardize this sort of training for several centers who are offering this. So that I think one of the recommendations that's come out is about National Peer Accreditation Service. So we will have those discussions outside this webinar. So again, please do put in your comments, chats in the text box. Just to remind you, there is a Mentimeter question. So we are 10 minutes roughly behind schedule. So please do complete those questions, which will help us finish the session on time, or at least 5 minutes behind schedule if possible. So please do access those Mentimeter questions and complete the prioritization recommendation questions and your pledge, please. Next, we are going to move on to the regional approach. So we have heard from Louise about how to set up peer support in a single center and the challenges faced by individual centers. Andy and Paul Bristow are going to do a dual act on how they've done this at a regional level, both in York and London. So over to you, Andy, I think is going first.
Okay, Paul Boy, I think, is just going to do a quick intro.
I was asked by Andy to give a minute's quick intro. This whistle-stop tour of peer support has been brilliant. The question of why we started doing in New York has been answered by Louise from a brilliant experience in Oxford. One quick point about why it's hard work. My personal feeling, or maybe Andy will agree with me, is because it's still seen as a nice to have service rather than an essential part of what we need to offer to every patient on their kidney journey. The work that Andy is going to present is purely due to his hard work and commitment. So I don't want to take away his thunder. But we had three aims when he started off in New York. One is to provide a structured training process. It was never rigid because we had to adapt to COVID restrictions. The second part is we have proven to our MDT that the peer support service that we provide now is as good as the informal service that was always in place in New York. And the third bit is that we have created the back office functions, the stuff that is boring in terms of governance, data protection, DBS stuff and everything else, so that others don't have to reinvent the wheel. And we've sort of done our best to make it portable to other units so that others can take off from what we have done. I'll hand over to Andy now. Thank you.
Thanks, Paul. There's a lot of the activities which have gone on before here actually outline what it is that we've been doing at York. So I'm not going to cover those. This is a bit more about the practical aspect of how we've set this up. I will say, however, that this type of thing is really interesting because I dare say between ourselves, we could actually answer a lot of the questions that we each individually have. Slides have stopped. Okay, so we're trying to facilitate the patient voice within York, but we're also trying it across Yorkshire and Humber. And I'm very briefly going to go through the background, the setup, funding, implementation, future, sustainability, and we're not going to be doing any Q&A. So we have a team of three of us, myself, a kidney patient, 4 years hemo, 12 years transplant. We've got Dr. LeBoy, and then we've got Mel, who's also on the call. The funding, we are really grateful from Kidney Care UK in the first instance for providing funding, which has then enabled, for example, for the hospital to take that funding. I'm now employed through the hospital on a number of days through the fund, and the fund also helps with Paul and Mel's time. We've also done some of our own funding, which is through Aviva, and the hospital itself through its trust has done matched funding with Kidney Care UK. Team also includes those that are on the right hand side there. So we are really interested in patients and carers, and in varying times families as well. But you can see it's not just us three, and we have nurse champions that are also helping with the process. I'm going to shoot through this slide, but we know what peer support is. That's been well talked about and documented throughout this particular session. We went through a mapping process, so we looked at, and it was raised earlier on, the whole idea of it was to take the patient and carer from clinic level right the way through their kidney journey. We did a mapping process, a paper-based process, put that into some form of notice, did a bit of a diagram, and then came out really with areas where we found that peer support would touch various aspects of treatment journey. Toolkit's been well talked about. We use the toolkit really as a skeleton. At the time this was coming out, the program was just starting, so we did our own audit of peer support programs from mental health, diabetes, etc. But this one came out, so we modeled ours on this one, and I'll do a little tiny bit more about that, how we use that in a second. We have our own resources, or these have been developed as a card, a pen. We have our own website, kidneypeersupport.com. When we first started, we had a number of information aspects which went out: PowerPoint for patients and carers, leaflets for patients and carers. Again, we have different posters that went out. That was one of our first training ones on the right, but that's clearly since changed since then. That was the handbook actually that Eleri was on about. So we've took that one stage further and put it as a flip book, so you can get it either a paper-based version, which we will send out, or they can get it online as well. And it just flips like reading a normal book. And then we have the PowerPoints, which is really much taken from the essence of that is taken from the notes and from the training on the toolkit. And we have a newsletter which goes out, which is then supported by social activities which the group do. Training, we provide 3 training sessions. These are 3 2-hour sessions. For us, it's done on a Thursday, 6 till 8. We're looking now and are developing pre-learning through e-learning and some post-learning and evaluation online. Just typical. This is very much coming out of Eleri and Nicola's toolkit. Just a quick word on the scenarios which Eleri brought up. What we've done is we've asked each of the MDT departments for a 3-minute video, which they do, which explains what their role is, and also to do 3 type of scenarios that could happen at York, which maybe would have happened at York, which you would expect peer supporters to be involved with. So they've written those for us, and they've given us sort of like a DS solution, so to speak. And then we've embedded those into our program from right across. So not only do they get to meet who the MDT are, but where the MDT members are available, they will come and deliver that training, or myself, Mel, and Paul will deal with that. And again, it's Kidney Care UK is UKKA approved. I'll give you a minute just to have a look through this here. And from a patient's point of view, the bottom one is really appropriate. Without this magical NHS word of co-production, it's not going to work. So you need to have champions across the whole area, and peer support needs to be integral to the renal service, not separate to it. Very briefly on the future, so we're continuing to look and help Kidney Care UK with the network. We are currently going through an audit and evaluation of where we are and what we're doing and how it's going to go forward for next year. We're also integrating into the long-term conditions for the hospital, looking at particularly around diabetes and cardiac, as well as looking at limbs, AIDS, and other activities to try and see if can get a little network going together at the hospital. Cross-working, co-production, working with others. Currently, we're working with Bradford, Hull, Leeds, and the North East, and sustainability and funding. I mean, that's an issue for everybody. And I dare say, Uday, I'll have something to say about that at the very end. We are starting with a kidney information network, which is something which is sort of beginning to grow nationally. There are 2 networks in the Northwest, and it's very much an information-based online network. We have the Kidney Patient Involvement Network as well, which I am co-founder and co-chair of, where we're trying to help those that want to be involved with peer support, running it and trying to help those in various aspects of that. Clearly, we have the NKF. Stephen did a very good presentation on that. And then clearly, we've also got the young adults as well, which we need to take into account. And so it was supported by the UKKA. And that's me.
Thank you, Paul and Andy. We'll have Paul Bristow now presenting on the model from London. Then I can quickly summarize the 2 models at the end of that session. Paul, over to you.
Thanks, Uday. Are my slides showing?
Yes.
Yeah.
And what time do you want me to finish by?
you take, I mean, as we agree, 10 minutes. I think the webinar is 10 minutes behind schedule. So hopefully we should finish by 10 past. So
Okay.
if you're happy to take 10 minutes, that would be great.
Yeah, I'll try and pull you back some time. Thank you very much, and hello everyone. I just want to pick up on a couple of previous points, and my first one is this presentation's titled Peer Support, a Regional Model. This is not saying that a regional model is the only solution. As Eleri said, peer support can come in many different formats, and patients should be able to pull it in a way that they're happy with. But we do think, given the current landscape, this is one potential model that could be followed. And secondly, picking up on Paul Leboy's point, I think the nice to have comment is very pertinent. And I think that leads me on to my second slide, which is the importance of peer support. From a patient perspective, we believe it's one of the most impactful interventions that actually isn't in the service spec or commissioned, which probably sits behind some of the problems that we've spoken about. We know, as Eleri has highlighted, it's a simple, low-cost intervention that provides information, emotional support and reassurance. And studies have shown it's effective improving healthcare outcomes and can even assist in treatment decisions. And that's a quote from a patient who's been through one of the recent programmes. The challenges we heard about from Eleri, the provision of peer support is patchy in terms of availability and quality. There is no equity of access to high-class services for patients. It's been delivered at trust or unit level, and often as a result of the passion and commitment of one, often lone, healthcare professional. Someone earlier mentioned the loneliness of perhaps trying to raise the profile of peer support across a whole NHS trust. It's difficult to develop and expand due to the limited time available to run the programme, often for that one individual. And surprise, surprise, sustainability is a challenge, as there's often no formal recognition or embedding of the peer support service in the operations or patient pathways. I've certainly got personal experience, and I suspect many of you had, of a trust that used to have a fantastic peer support service that suddenly disappears because the individual who was championing it and doing all the work simply moves on, retires. So, given where we are, is a regional model one solution that might suit in parts of the country? The London Kidney Network and Kidney Care UK are developing a partnership approach for a pan-London peer support service. I think we believe that it combines the essential buy-in, commitment and leadership from the healthcare team on the ground with the additional resources and support from the patient-focused third sector. If you combine those in a synergistic relationship, we believe that can have that will have real traction. What it requires is a commitment from each trust for a champion to raise awareness of the service, help recruit volunteers, promote the service and referrals. The burden of day-to-day administration is removed from that healthcare team. Activities such as coordinating training, matching and organising sessions, management of volunteers, etc. I think it encourages and ensures consistency in quality and delivery, but also reduces duplication. If you have 3 or 4 London units each doing a peer support service, pooling those resources would seem like an efficient way and also expand the number of peer supporters available. The regional network lead is part of that, which in this case is Eleri, appointed, and development of a leadership community of practice, i.e. each trust champion forming a community of practice to work together, which is part of raising the profile of it as a legitimate and supported service by the local regional network. It's a team approach, not a single, often isolated individual. You're part of something much bigger, which is endorsed by the regional network. So, in summary, it leverages the core strengths of regional networks. One of the reasons for clearly bringing in the regional networks was about leadership, coordination and equity. That bestows credibility and gravitas. This is important and part of our core plans. Reduces duplication and establishes common standards. Drives efficiency. It's about a team, not an individual approach. It helps embed peer support into renal pathways and therefore obviously supports sustainability. And it's an opportunity to better engage with commissioners in the future, which, as Uday said right at the start of this, we need to develop the evidence base and use the renal networks to be pushing our case for commissioning formal peer support. It adds the wraparound additional support from the third sector in a partnership for a common purpose and a shared vision. And finally, I think it provides a platform for scalability, choice and bespoke development. So you can start small, but then develop in terms of size, volume, and then bespoke peer support schemes, whether that's through modality, ethnic background, stage of kidney journey. So in summary, it's one model. This is one approach to it. But I think given the current landscape we're working in and the partnership approach between healthcare professionals and charities, I think it's got real ability to perhaps change the landscape. And hopefully that was just less than 10 minutes, Uday.
Thank you for that. Thanks to both the groups for presenting the regional approach. I think there are lots of advantages, as you pointed out, in terms of connecting centers who are trying to set up their own individual peer support group. So it's a way of overcoming those challenges at a much more regional level. It certainly gives some sustainability to those projects because people do drop out, both patients as well as champions from individual centers. So if you do have that regional model, it gives you that sort of backup support. So certainly that's a model that we certainly need to think about exploring more nationally for long-term sustainability. And as I said earlier on, we are continuing to have conversations with key people, commissioners and RSDP leads on whether some of these can be to some extent be more specific within the service specifications and how much of these can actually be mandated and not be any longer the nice to have option. So there are ongoing conversations. Hopefully we will be able to get somewhere with that. So we're moving on to the last session. So thanks to all the speakers so far. So there's lots of comments on the chat box, which is very helpful. So I'm going to go on to the last session, which is about prioritization of the recommendations. I hope you've all had time to look through the Mentimeter questions. Maybe Kay can share those questions now. So what we are going to look at is the patient recommendations and the healthcare professional recommendations. We normally prioritize ideas or solutions coming out of that in two ways. One is based on their impact, and the second thing is how easy or difficult it is to implement. So these are the responses from people attending the webinar today. So in terms of the impact, people feel that proactively and regularly offering peer support to all patients through formalized services is an easy one to, or will have the highest impact. Establishing best practice peer support models. Again, that's something we need to understand, evaluate, especially the regional models going forward to create more evidence base, and having a national peer accreditation service, as we talked about earlier, so that this training provided to peer supporters is standardized will be great. Okay, so those are the three high impact recommendations that we should take forward as a group. Moving on to the next question, which is on the difficulty. So this is the top one is, I think, the easy one. Understand, Kay, correct? So easy to difficulty. So the first one is about establishing best practice peer support models. The next one is about peer accreditation surveys. Again, review of current evidence. So the top two comes in the first three, both in terms of impact and easy to implement. So as you know, we discussed about forming a national working group. So there may be lots of people who are experts in these areas and who are keen to join this group. So I think there was a question within the registration form for this webinar to express your interest. If you haven't, please do contact the K-Equip team, Georgie or Kay, to express your interest. We will approach individuals to help us join the working group at a national level to take forward some of these recommendations. Okay, so that's good. So what I would like to do is, as the last one, is to show the response on the pledge. So how did this webinar influence you in terms of taking this forward within your local center? So there are some good quotes here, so I'll let you read through this. All of this will be captured in a recording, and I'm hoping we will be able to put it on our CAPE website for people to access this at some point. So in the interest of time, I won't go through each of these codes, but we will, as a group, reflect on all of that going forward. Excellent. Okay, as the pledge comes through, what I'm going to ask for one more favor from people attending the webinar is there is a feedback form, and I would really appreciate if you could complete the feedback on this particular webinar, because it helps us shape our future webinars, both in terms of content and how we deliver that. Certainly feedback from the first webinar was taken on board, and we have designed this webinar based on the feedback we've had from the first. So please do complete that feedback survey, and think Kay will put that on the chat box if you can, please. There is an MS form. If you click on the link, that should take you on to the survey. So it literally takes a couple of minutes for people to complete that, and we would very much appreciate for that feedback. So I hope you all had some helpful information shared through this webinar and feel inspired to take some of this work to your local centers. The key messages I can see from this are connecting with other people who are already setting up things. There is the WhatsApp group, as Kidney Care UK mentioned. On their platform, there is a toolkit that several centers have used, which people have found useful. It's something you can approach. The third key message is don't try to do it alone. Please do connect with other centers and people doing this, and try and explore regional models to setting up peer support. As a national body and as the DAYLife program, we will continue to work on this because this is one of our priority areas. We will establish a working group, and there is a national home therapy summit we are hoping to have in March, where we are going to try and launch some of these workshops, working groups, and the agenda going forward. So there will be some comms sent out in the next few weeks around registering for those events and summit. So thank you all for joining us today, and thanks for sharing your experience and all the hard work you've done over the last years. And hopefully we will have more updates in the next 3 to 6 months in the Home Therapy Summit on where we are with the peer support and the work we've done between now and then. Thank you all for joining. Please do complete the survey feedback. And for those presenting today, I think we have a after webinar catch up. So I think you probably need to stay back on this link, I think. So the Home Therapy Summit is on the 12th March. There will be details and comms sent out over the next few weeks. Please do look out for that.
Thank you, everyone.
Thanks all.
Thank you all. Thanks for joining us today. Okay, are we staying on the same link, or do we need to come out of this and join another link?
No,
No, we're staying on
Save.
the same link.
Okay.
Kay, before you dash, are we, in terms of the chat, are you able to copy and paste it, or will it stay there? I just don't want it to go anywhere. I want to kind of keep hold of it if possible.
It's not going anywhere, don't worry. I'll be able to pull it at any point, Georgie, don't worry.
That's great, thank you. Well, that was really great webinar. Thank you. All the
Thanks all for
fabulous.
sharing your work. We got maybe 10-15 minutes. I need to leave at least by sort of in 15-20 minutes to go and pick up my car before the garage closes. Otherwise, I won't have one for tomorrow. I need to go to Horton to a clinic. So thanks everyone for joining today. So hope that was useful. Maybe we can just have a quick discussion around the positives to start with. Please feel free to comment, share your thoughts on how the webinar was in terms of the structure, the prep going into the webinar, the layout, and Paul.
I thought it was excellent, and I'll tell you one of the main reasons, Uday, was what people heard in lots and lots of sound bites was that peer support isn't a sort of a not happening very much across the country, but you know, it's happening in London, it's happening nationally, it's happening with you know, lots of people in Oxford, York. And I think sometimes that cumulative impact of maybe this is an agenda we ought to get on quite quickly. I thought it was a rare thing, but actually maybe it isn't quite so rare. And then secondly, I think we offered them solutions to help them get started. So I think it did two big things, which is to raise awareness that this peer support is here and there's lots of activity going on around it. And secondly, you know, you're not on your own. There's lots of people you can contact